In this video, I'm going to demonstrate SNAG. SNAG stands for Sustained Natural Apophyseal Glide. That means your glide will be sustained and the patient will be moving affected portion of the spine in offending direction. It could be flexion giving pain to the patient, or it might be extension. It could be side flexion on any of the side, or it could be rotation. Indication for SNAG is pain or stiffness in single motion plane of the spine. In this, depending on the area you are treating, you will use the contact area. Like for the cervical spine, you have to use the medial side of the thumb and you can push it towards the eyeball. In this, you give the glide in the treatment plane. In the lower cervical spine, that is C3 to C7, the treatment plane is towards the eyeball of the patient. So you're going to use the medial side of the thumb, take out the skin slack, push it mid to end range, and then ask patient to do the offending movement. If the movement become pain-free, you may ask patient to give the passive overpressure at the available end range. If patient is having pain on one side of the neck, you may prefer to do unilateral snag instead of doing central snag. In case of unilateral snag, you will use the medial side of the thumb behind the facet joint and the treatment plane will remain towards the eyeball of the patient. But if the patient is having pain on both sides, you may prefer to do it under the spinous process. How do you decide whether to give unilateral or the central snag? You will choose the snag which remove pain of the patient and increase range of motion. Now you must be thinking how to decide the pressure. How much pressure should you be giving while doing the snag? You will select the amount of pressure, the one which take away pain of the patient. So you have to constantly communicate with the patient whether your glide is pain-free or not. Your pressure should be such that it should remove pain of the patient and increase range of the patient. You must synchronize well with the patient in order to sustain the glide. As the name implies, sustained natural apophyseal glide. You must not be faster or slower than the patient. You have to move with the same speed of the patient. You will be hooking the inferior portion of the spinous process there, or if you want to do the unilateral snag, you will be working on the facet joint, articular pillar of the cervical spine. And why I am going to push it towards the eyeball? Because this is what the treatment plane is, anterior-cranially. That is towards the eyeball you need to snag. It is best indicated for C3 to C7 level. So the hand placement is going to be the medial part of the thumb, and then this is going to be pushed by another thumb. We are not going to use pulp of the thumb purposely, because if you use pulp of the thumb, you're going to push two spinous process simultaneously. And to avoid two spinous process, I'm going to use medial side, so you move only one segment at a time. So I'm going to hook the spinous process there with the medial side of the thumb and then push it with the other thumb towards the eyeball. In case you want to do the unilateral snag, you'll be using the thumb there on the articular pillar or the facet joint you may call upon, and then push it with the other thumb again anterior cranially towards the eyeball of the patient. You will use the medial side of the thumb under the tip of the spinous process, and you will take out the slack by moving the skin and hook the spinous process there. Fingers will be resting on the temporomandibular joint of the patient. Make sure it is not on the neck of the patient, as it may block the carotid artery. So you will take out the slack, hook the spinous process, and ask patient do the offending movement. Ask patient if that is comfortable to the patient or not. If that is comfortable, ask patient to do the offending movement. Like in this case, offending movement is flexion. Ask patient to bend forward, and when patient is going forward, ask patient if that is pain-free. If it is pain-free, she can apply passive pressure using her both arms in the same direction, and then you come back gently. Imagine it is a right side flexion giving pain, so I'm asking her to do the right side flexion, and patient will give passive overpressure only if it is pain free and you are able to gain some range of motion. If it is left side flexion, go for the left side and then ask patient to give the passive pressure in the similar way, or it might be the extension causing pain to the patient, and then we'll ask patient to do the extension and make sure during extension there is no passive overpressure. If it is rotation, you ask patient to do the offending movement and then you move back. Again you're maintaining the push towards the eyeball only, and if it is pain free, patient can give passive pressure. In case you want to do the unilateral snag, then instead of hooking the spinous process, you will use the medial side of the thumb over the facet joint and you will push again towards the eyeball only. Like in this case, patient is having pain on the right side, so my right thumb will be over the affected facet joint and my left thumb will push that facet joint up towards the eyeball. Ask patient to go for flexion, or we can ask patient to go for extension. We can ask patient to go for contralateral side flexion or the ipsilateral side flexion, ipsilateral rotation or contralateral rotation, and don't forget to give passive overpressure in case you gain new range, and if it is pain free you must give the passive overpressure. While doing snag, make sure you synchronize well with the patient and you have to move with the same speed as the patient is moving. Concentrate on direction of my thumb movement. It is moving with the same speed, not faster, not slower than the patient, so that you sustain your glide. It is snag, sustained natural apophyseal glide. Your glide must be sustained throughout.